Understanding mental health conditions is crucial to providing the right support and treatment. Bipolar disorder and borderline personality disorder (BPD) are often misunderstood, with overlapping symptoms that can lead to confusion. However, these two conditions have distinct characteristics, and knowing the difference is essential for proper diagnosis and treatment. In this article, we'll explore the key differences, the symptoms, and why accurate diagnosis is crucial for managing both bipolar and BPD. What is bipolar disorder? Bipolar disorder is a severe mental illness (SMI) that causes extreme mood changes, including periods of intense mania or hypomania and deep depression. These mood swings are much more intense than regular feelings of sadness or happiness and can last for days, weeks, or even months. Bipolar disorder can affect anyone, regardless of gender, background, or social class, and it requires ongoing management to maintain mood stability. Symptoms of bipolar disorder: manic or hypomanic episodes, high energy, impulsive behavior, overconfidence, and reckless decisions. Depressive episodes: extreme sadness, fatigue, loss of interest in daily activities, and sometimes thoughts of self-harm. Cycles of stability: periods of stability in between episodes. What is borderline personality disorder (BPD)? BPD is a personality disorder characterized by emotional instability, impulsivity, and difficulties in relationships. People with BPD often have intense emotional experiences, which can change rapidly and may include mood swings, outbursts of anger, and impulsive behaviors like self-harm or suicidal thoughts. The condition often stems from childhood trauma, including abuse or neglect, and can affect a person's sense of self and their ability to maintain stable relationships. Symptoms of BPD: emotional instability, intense mood swings, often occurring several times a day, fear of abandonment, difficulty with attachment and unstable relationships, impulsive behaviors, engaging in risky activities or self-harm, disturbed identity, difficulty maintaining a consistent sense of self. Key differences between bipolar disorder and BPD: mood changes. Bipolar: episodes of mania and depression that last for days or weeks, with periods of stability in between. BPD: intense and short-lived mood swings that occur several times a day. Emotional regulation: bipolar: the mood changes are typically more extreme and last for a longer period. BPD: the emotional instability is more chronic, affecting a person's relationships and sense of self. Focus of the disorder: bipolar, primarily a mood disorder, focusing on energy, mood, and activity levels. BPD, primarily a personality disorder, affecting emotional regulation and interpersonal relationships. Why is it important to tell the difference between bipolar and BPD? It is crucial to differentiate between bipolar disorder and BPD because each condition requires different treatments. Bipolar treatment typically involves medications like mood stabilizers, antidepressants, and antipsychotics, along with psychotherapy to help individuals understand and manage their triggers. BPD treatment focuses more on psychotherapy, such as dialectical behavior therapy (DBT), to help manage emotional regulation and interpersonal relationships. Medication may be used to treat symptoms, but is not the primary treatment. Co-occurrence of bipolar and BPD. In some cases, individuals may have both bipolar disorder and BPD. Research suggests that about 20% of people with bipolar disorder type 2 and 10% of those with bipolar type 1 also have BPD. When both conditions are present, individuals may face more severe emotional regulation challenges, increasing the risk of self-harm and suicidal behavior. The importance of accurate diagnosis: misdiagnosis can lead to ineffective treatment. If symptoms of bipolar disorder and BPD are confused, the wrong treatment plan may be prescribed, worsening the condition. If you suspect that you or someone you know has been misdiagnosed, it's crucial to speak with a healthcare professional for an accurate assessment. Conclusion: bipolar disorder and borderline personality disorder are two distinct conditions, but they share some similar symptoms, making proper diagnosis essential. Understanding the differences between them can help individuals get the appropriate treatment, improving their quality of life and emotional stability. If you suspect you or someone you know might be struggling with one of these conditions, seeking professional help is the first step toward proper management.